Hello everyone, and welcome. I'm excited to kick off today's presentation on newer study designs, focusing particularly on flexible dose design. We'll explore how these innovative approaches are shaping research and improving outcomes. Over the next few slides, we'll cover the key concepts, benefits, and practical applications of flexible dose strategies in clinical studies. Let's get started. Let's talk about flexible dose design, which is also known as a titration design. In this type of trial, the dosage isn't the same for every participant. Instead, it's adjusted based on how each person responds. The goal here is to find a balance, maximizing the good effects or efficacy while minimizing side effects. In everyday clinical practice, doctors rarely give every patient the exact same dose of a medication for blood pressure or anti-anxiety treatment. They tailor the dose to each individual's needs. Flexible dose designs bring this real-world approach into the research setting, making studies more reflective of actual clinical decision-making. It helps us understand how different doses work for different people, which can ultimately lead to better personalized treatments. Today, I want to walk you through the working process behind our titration method. Essentially, in this design, every patient usually starts at the same low dose, which we call the starting dose. From there, at regular intervals, our research team evaluates each patient's response. Based on what we observe, we adjust the dose either up or down along a predefined dosing ladder. Now, if a patient isn't experiencing enough benefit but can tolerate the medication, we increase the dose. This is what we call up-titration. Conversely, if a patient is seeing positive results but is also experiencing high toxicity or side effects, we lower the dose. This is down-titration. And when we find that ideal dose, what we call the sweet spot, where the patient gets maximum benefit with minimal side effects, they stay at that dose for the rest of the trial. This approach allows us to personalize treatment, optimize outcomes, and ensure safety throughout the process. It's all about balancing efficacy and tolerability to find the best possible dose for each patient. Let's take a closer look at the benefits of a flexible dose design and the logic behind it. First, higher retention. When patients can adjust their dose to a tolerable level, they're less likely to drop out of the study due to side effects. This means we get more reliable data and a better understanding of the drug's true potential. Next, real-world evidence. This approach gives us a clearer picture of how the drug will actually be prescribed once it's on the market. It reflects how clinicians will use it in everyday practice, making our data more applicable and meaningful. Then, safety comes into focus. By allowing dose adjustments, we can prevent overdosing, especially in smaller or more sensitive patients who might need less to see benefits. This personalized approach helps us prioritize patient safety without compromising efficacy. Now, why is this particularly important? If we're working with drugs that have a narrow therapeutic index, that is, the difference between an effective dose and a toxic dose is very small, a flexible dose design becomes essential. It helps us find that optimal balance, ensuring patients get the right amount without risking harm. Overall, this design not only enhances safety and real-world relevance, but also improves study retention, which is crucial for gathering robust data. It's a strategic way to manage drugs where precision is key. Thank you so much for being here today. I really appreciate your time and attention. If you found this presentation valuable, please consider subscribing if you haven't already. It's a small step that makes a big difference in staying connected and up to date with future content. Once again, thank you for your support, and I look forward to seeing you in the next one.